Telman. So I'm really excited to introduce our next panel where we are going to talk about health equity, innovation, and board diversity. We're going to welcome back our moderator, Errol Lewis from earlier this morning, who's going to be in conversation with Daniel O'Day, the CEO of Gilead, Deborah Telman, who is the Executive Vice President of Corporate Affairs and General Counsel, also at Gilead, Anthony Welters, founder and chairman and CEO of CINQ, Inc., and Kevin E. Lofton, former lead independent director of the board of Gilead Sciences. Please give it up for our next panel.
Okay. All right, thanks very much. This is an exciting and an important subject for a lot of us, and you'll hear more about it. There are some exciting breakthroughs that would actually constitute breaking news about what is being done that's going to be of special importance to people in our community as far as the actual health. So this is partly about corporate governance, but the end product is also important, and we don't ever want to lose sight of that. So I want to thank the panel. Gilead is an important player in the healthcare space, and I want to start with you, Dan. Forbes has listed the company as one of America's best employers for diversity. It's got one of the most diverse boards among Fortune 150 companies. And of course, that doesn't happen by accident. What's the strategy? Is this something you set out to achieve, and what's the goal?
Thank you, Errol. Thank you very much for having us. I'm delighted to be here with my colleagues as well. Well, yes, it doesn't happen by accident. It has to be very purposeful. I think, in my journey, in life and in the business world, there are two reasons why I think that's so important. One, I think it's very important to business success to have a diverse board and have a diverse population of individuals within the company that are working on intractable problems. And secondly, it's linked to our strategy directly at Gilead. But let me first talk on the business performance side. I mean, many of you know the figures. It's very clear that, when you have a diverse organization, in fact, the top quartile of companies that have large ethnic diversity, and it's also true with gender diversity, perform better than other companies. They're 40% more likely to be financially successful. They're twice as likely to have healthcare innovation. And so, as I came into Gilead 5 years ago with my experiences, it was very important that if those facts are true, and I believe them to be true from my own experiences, that we worked also on our board diversity as well. And I was delighted at the time to work with Kevin to really, over time, kind of shape our board to represent, frankly, the communities we serve and to help us make better decisions accordingly. And so over the course of the past 5 years, I think, we've been on a journey to put together a top-notch board. I mean, leaders in their field in every regard, in every respect. And Kevin and Tony are two of our 8 board representatives that are phenomenal leaders and also happen to be Black leaders that represent their lived experiences on our journey. I think that's very important, particularly when one wants a company to represent the communities you serve, to have that type of diverse representation at the board level, at the management team with Deb, so that individuals can make sure that they see themselves in the strategy and where we're moving as a company. But really importantly is Gilead's approach and our strategy to the medicines that we discover and have an impact on global health. And in that regard, Gilead works on diseases that have a disproportionate burden to Black communities in this country and around the world. Diseases like HIV and cancer, breast cancer. HIV, I mean, just to put it in stark clarity, more than 40% of new HIV diagnoses in this country, in the United States, are from the Black community. And the Black community, as we all know, represents around 13% of the US population. So there's a disproportionate impact on HIV in this country and frankly around the globe. With triple-negative breast cancer, you're twice as likely, Black people are twice as likely to contract triple-negative breast cancer and 40% higher rate of dying from the disease than other ethnic backgrounds. So it's extraordinarily important that as we think about our strategy and think about both the science side and the health equity side that we're focused on, that we have the type of decision-making capability within the organization in the boardroom to help us make the most critical decisions around our strategy and where we're heading.
I want to get back to board diversity in a minute, but you were telling me right before we came on about the breakthrough, the clinical trials for something you call Purpose One. Explain a little bit what that means and what you hope or believe it will mean for sub-Saharan Africa.
Look, I think one of our goals at Gilead, we've been brave and courageous. Our colleagues have cured diseases like hepatitis C, and today we've turned HIV from a death sentence over the past 30 years into a chronic preventable illness. However, the problems that I just mentioned persist, particularly in communities that are underserved in this country and certainly in sub-Saharan Africa, Central Asia, Eastern Europe. And this medicine, lenacapavir, despite the fact that after 30 decades of innovation, we have a pill that you can take once a day that will essentially suppress your virus and make you untransmissible or prevent the disease, there's still a large portion of people that don't, that where one pill once a day isn't the right solution for them. And this is true in underserved communities. Lenacapavir is probably the most important breakthrough we've had so far in the prevention and treatment of HIV. And the study, Errol, that you referred to that just read out is extraordinary. This is the largest, most diverse clinical trial population and suite of studies that we've had so far. The first study read out, and the first study was in women in sub-Saharan Africa, 5,000 women enrolled in this trial. And this is adolescents and young women. And what we found is that with this medicine, lenacapavir, that you only have to administer twice a year. So we've gone from the once a pill, once a day, that most people don't comply with when you don't have an illness in particular. And even when you have an illness, you may not comply, to twice a year, simple subcutaneous injection. And what the trial showed in this population is it was 100% effective. 100% effective in women in sub-Saharan Africa. It prevented them from getting HIV, whereas if they were on the other arms of the study, which were the oral daily pills, it was roughly the same incidence of around 2 to 2.5 per 100 individuals that contracted the disease. So this is an extraordinary breakthrough. When we say we want to end the HIV epidemic for everyone, everywhere, it has to be done in all parts of the world. And when we approach science and our work with our community partners on access and innovation, it's always with that intent. How do you think differently about the science to provide a medicine that people can actually comply with to actually end the epidemic?
Okay. Deb, I want to ask you, you're not only Executive Vice President of Corporate and Legal Affairs, you're the General Counsel for the company and the Corporate Secretary for the Board of Directors, meaning you are dealing with all of the compliance, all of the particulars. I believe they're all on. You should be fine. Yep. How has your role as Corporate Secretary in particular for the board influenced how you lead the organization, and what is the role diversity of the board plays in its success?
Thank you for that question. First, it's a pleasure to be here at the Global Black Economic Forum, to hear from such wonderful speakers. I'm really excited to be on this panel with my directors and my CEO. When I think about my role at Gilead, essentially it's like heading up the governance for the company. It's a public company. I work closely with the board, including Kevin as former lead independent director, and now Tony, who is our new lead independent director, as we discuss and talk about the board, how the board is overseeing strategy, how they're monitoring Gilead and the risk that we have with our stakeholders, including our shareholders. So I'll spend quite a bit of time talking to our shareholders about how the board is managing the strategy, how they are assessing risk, how are they working together in terms of leading the company. And the question that always comes up, what does diversity mean for the board? So they want to know how we're looking at diversity. And as Dan said, we know when we have diverse board members, and we do, about 77% of our board members are ethnic or gender diverse. So I really think it's one of the highest diverse boards among Fortune 150 companies. They want to understand how we think about it in the boardroom. So we have a chance to explain how we see bringing these different and lived experiences to our discussion around our strategy, our discussion around succession planning within the board, discussing how it impacts risk. Because we know when you have diverse people, you can help identify a potential risk and mitigation strategies. You also can enhance innovation, and Dan mentioned all the great work we have around health equity, particularly around Black women who have been disproportionately impacted by HIV. Women in general are not included in clinical trials. Our clinical trials actually had pregnant and lactating people as a part of the clinical trial that Dan mentioned in Africa, which is really important because we want women who are pregnant to take this medication. We want to make sure that HIV is not passed to babies, and unfortunately that still exists in many parts of the world. So our lived experiences are part of that discussion as we think about strategy and health equity. And that's something that our stockholders, our significant shareholders want to know because they also believe it's important as well.
Is that a competitive advantage, what you just described?
Yes, it absolutely is. We have 3 female board members who are extraordinary, chemists and chief medical officers who can come in and provide us with perspective around women. We have Kevin. We had Kevin, I should say. Unfortunately, he retired. We have Tony. We have a new board member, Dr. Ted Love, who just joined us, who is making a difference in sickle cell anemia. So we have all this great expertise that could be part of the conversation to make sure those communities that have high unmet need, unfortunately many times it's Black communities, their voices can be heard and pulled through as we make decisions.
Okay, so now, Tony, you currently serve on multiple corporate boards, including Lowe's, Carlyle Group. What was it about Gilead that attracted you as now the lead independent board member, and what have you seen as the advantages of board diversity?
One, a parochial reason, and it's important. My wife is a survivor of triple-negative breast cancer. It is the most aggressive form of breast cancer. It impacts Black people disproportionately, and as Dan indicated, they die. So an opportunity to be associated with an organization committed to tackling a more challenging disease was something that inspired me. And then there's the selfish side. It's great to be around great researchers. So should there be a challenge, I don't have to go all across the country. I just have to walk into Dan's office. The other thing that inspired me about Gilead, they're about solving complex diseases. And they cured something. You know, people may not realize this, but when Gilead made the decision to cure hepatitis C, implicit in that decision meant that their revenues would go down and they would be challenged as an enterprise to continue to innovate. I've served on a lot of boards. I've engaged with a lot of venture capitalists. I could maybe count on a hand. They would say, let's go and do that and basically put our entire enterprise at risk. Gilead did that. And I respect people like that. I respect people who take the research and say, that's what we're about first and foremost. The other is this, it's real important. Diversity, disparities, access. For a lot of enterprises, they're buzzwords. We hear it, and we could probably look at when they started, and quite frankly, when they're starting to end. When we talk about diversity in the boardroom and other things. for Gilead, that's real. And in the boardroom, you can see the representation of people who are also looking at these challenges. And so what happens is when you're in an enterprise where everyone's rowing in the same direction, you feel good about being there. And I travel across the country because I live in Virginia, and I make it out to all board meetings in California. And I'm not into that Zoom stuff, okay? Because I need to be with my colleagues so I can learn from them and they can learn from me. But all of those things really inspired me to join the board of Gilead, and I'm glad I did.
Okay. Now, Kevin, you've been a member of the Gilead board since 2009. A lot has changed in healthcare and, frankly, in corporate boards and governance questions. What are the changes that you've seen, and what do you make of the current discussion about board diversity?
I've seen a lot of change. 2009 seems like an eternity ago, and the Gilead board was a lot different than what we're talking about here today. So when I joined the board, they hit the jackpot on diversity because I was the first, not only the first black person or minority, but the first healthcare provider. I was more than 10 years younger than the next closest board member. Hell, I was the only Democrat on the board. So we've come a long way. And a lot of that stems from leadership because the changes that we're talking about really took place about 5 years ago. So even though I was on the board 15 years, but it was Dan's arrival. You have to have a willing CEO. The board can push and the board can control and the board can make a lot of things happen, but if the CEO isn't on board, it's going to be very difficult to make those things happen. So when we talk about the role that Gilead plays, again, Dan and Deb can talk about the science as they have. What I look at as coming from the provider side of healthcare is that when you really look at the status of a person's health, about 20% of that, of your health status is really related to the medical condition. 80% of it is really related to what we call the social determinants of health. And Gilead attracted me because for a bioscience company, it also focused on that side of it. And so what do we say, the social determinants? We're talking about where you live, where you play, where you work, and where you eat. When you look at, you take those four factors. So when you look at the drugs that Gilead provides are disproportionately helping black people, then that's one of the things that's major. Looking at corporate boards today, we had the George Floyd push, where people were kind of feeling guilty, and they were looking to say, well, we don't have any on our board, so maybe we need to get one. And, you know, we kind of have the wings behind George Floyd has kind of run out. So I think the importance of having a diverse board is that when you have a CEO, a leadership team that aren't like the ones at Gilead, they need some help, they need some push. And I'll give you an example. So we had specific metrics around adding and increasing the number of blacks and Latinos in leadership roles and across the organization. And Gilead is south of San Francisco, so you can say, well, there's a small black population in Silicon Valley, small black population in San Francisco, so we can only do so much. But in working through the board, Gilead was going to expand its service center capabilities in IT and in financial services. So it would have been easy to say, let's just add that on our campus. We'll do the best we can to add more diversity. But what did we do? We decided to open it up in Raleigh, North Carolina, in the Research Triangle, where you have more black people that live there, and that helped us to achieve the goals. So you can talk about things, and then you can actually make things happen, and Gilead is one of those companies that makes things happen.
And Dan, why is it that some of your fellow CEOs, or even your rival CEOs, take a different approach? What are they missing that you'd like to maybe bring them up to date on?
Well, I can't speak for all of them, but I can speak for myself. You know, I had the privilege of working in many different countries around the world and seeing all types of diversity play out and then kind of measuring that from a business performance perspective. So maybe just to put it into specifically our industry, what they might be missing. You know, back to the conversations we heard also earlier today, the perseverance and conviction that's required to be successful when you're discovering a new medicine is extraordinary. The reason I mention that is, 12%, only 12% of everything we take out of research and put into actually human trials succeeds. In other words, 90% fails. So I guess I've just been, my journey has been, if you're trying to solve an intractable problem, like, I'll just come back to lenacapavir. Lenacapavir is a medicine that is 16 years in the making by our chemists and our scientists. And thousands of molecules did not succeed to find this one that succeeds. Our head of research calls it a unicorn in some regards. But that type of perseverance and those type of intractable problems in my journey and experience require different perspectives, all different perspectives to come to the table. People to ask tough questions. And, when I came into Gilead, I had, the privilege of having a board that was, that was there for me, but has also transitioned to pressure test our strategy at the end of the day. And I think that's been essential because it can be a very lonely job when 90% of what you're doing fails every day, and back to like staying focused on what you need to do. So you need a board, I think, that has looked at things from multiple different angles to solve the world's most intractable problems. And that's why I think we have medicines like lenacapavir, but equally, it's also why one of the reasons I joined Gilead is because they were one of the first companies, it would seem counterintuitive in some ways, to voluntary license a product. That means give up their patents in the developing world at the same time that they protect their patents in the developing world. In other words, to sustain a business and where it's possible to recoup an investment of 90% of things fail, but immediately, don't wait until the patent expires 13, 14, 15 years later, but immediately voluntary license it to generic manufacturers so that you can help those most in need around the world. In this case, it was largely Africa with HIV, but many other places, Southeast Asia. And so I think having a diverse board helps you take those decisions. One other example, COVID. Wasn't that long ago. We probably remember it. Again, the same scientists that are so expert at virology came up with the first medicine. It's still only medicine in the hospital to treat COVID. It saved countless lives. It's saved, because COVID disproportionately impacted the black community, it saved countless black lives. And immediately upon the discovery of that medicine, this board, Kevin, Tony, others, we immediately decided at the time of COVID to both donate all the supply that we had on hand when the medicine was first approved, but immediately voluntarily license that so that patients in Africa and elsewhere could have access to this medicine. In fact, of the 14 million people that have benefited from remdesivir, 12 million are in the undeveloped world, so to speak, of the 14 million. And that just goes to show you, I think, what a diverse board can do, to Tony's point, to Kevin's point, to Deb's point, around not only thinking about the strategy, but immediately implementing it and having the conviction to implement that appropriately. Because, you can do well by doing good.
Well, and I mean, you mentioned something to me backstage that many of our, yes, worth a round of applause, that many of our viewers, the audience, might not fully appreciate, which is that it doesn't do much good to provide a solution for a relatively small handful if there's a global pandemic, right? I mean, everyone will just get sick all over again.
Exactly. I mean, we deal with global infectious diseases. When we say we want to end the HIV epidemic for everyone, everywhere, those are carefully crafted words. Everyone means everyone, of every ethnic, gender, background, diversity, and everywhere really means everywhere. I was in Kazakhstan last week, where we do work with the Elton John AIDS Foundation. We have tremendous community partners here in this country and elsewhere that really address the underlying stigma and discrimination associated with HIV. And so not only the science, but our health equity and access programs are also pertinent to everyone, everywhere. And that's really what we're working on. It's why this intersection between science and community is so important. So in the Black community, we have a $100 million 10-year commitment to addressing HIV in the southern United States. We work through the Wake Forest School of Divinity that gets at the heart of trust about the healthcare system by working through faith organizations in the South. So it's just one example of really believing in our community partners and how important that is. That's as important as the science, because if you have a medicine that can cure HIV, but nobody trusts it, you don't have the representation in your clinical trials, people don't have access to it, then it's all for naught. So we have a firm belief in science and access coming together in a way that really gets at this. And we would like nothing more to do than what Tony said, is to work on another disease than HIV, and that's our intent.
You mentioned HIV, and Tony talked about triple-negative breast cancer, where Black women have a 40% higher mortality rate. And Deb, I wanted to ask you about, as well, multiple myeloma, which occurs twice as often in Black Americans as white Americans. And what role does Gilead play in trying to close all of these kind of health gaps from your point of view?
Yeah, no, so unfortunately my sister passed away from multiple myeloma, and Gilead, through one of our companies, Kite, has a clinical trial focused on multiple myeloma. And again, another devastating disease that disproportionately impacts Black people. She lived a long time, but ultimately she passed. And I know this is about wealth, but your health, if you don't have your health, you don't have wealth, right? So for me, it's so important that we can make sure our community is served by all these great medicines that are to come by getting into clinical trials, and making sure we have our representation in the clinical trials that we have, which we've done, but actually delivering on those promising medicines that can help so many people with this kind of disease. So, that's the reason I joined Gilead. And I do think the competitive advantage we have is the great innovation, the great science of the company, but we marry that with a focus on health equity. And we have teams at Gilead that work with community partners to make sure we show up as a trusted voice in the community, so they know that we're working with them, we're co-creating with them. They can help us enroll more Black people in our clinical trials. And that's how we really make a difference. And it's really, to me, our competitive advantage. And this conversation that the board has as well.
Tony, talk a little bit about cross-industry partnerships in closing healthcare gaps. There are so many different kind of corporations and supply lines and so forth that you're personally involved in. Where's this going?
If you think about it this way, between the federal and the state government, out of every healthcare dollar spent, about 63 cents comes from the government in one form or the other. So public-private sector partnerships, we should have been doing them years ago, okay? But that's the sweet spot, because what you want to do is to bring together great researchers, great scientists, with community advocates, with government, so that we can be more laser focused on problem solving. And as I see the future, I see much more of that collaboration. One of the things, I was joined Gilead's board at the outbreak of COVID. And Dan and I, we were having this conversation, because the great challenge was getting access inside Black and brown communities. And I urged Dan and his colleagues, they should go to CDC, they should go to the White House, and they should educate them on what you've achieved. Because remember, Gilead invested heavily and continues to invest in engagement inside communities. So they have, think about this, they have greater access into hard-to-reach communities, in particular Black and brown communities. They have greater access than the government. And so this notion of lessons learned between the private sector and the public sector really can be game-changing, because in Gilead's situation, they can't do their job without getting access. They can't talk about it. We have metrics to look at penetration. How are we doing today versus yesterday? And those skill sets, those metrics are things that I think companies like Gilead can bring to government. So government is more focused on outcomes and strategies that are measurable. So that's how I see the public-private sector partnerships.
You know, something you mentioned, Kevin, that really struck me. You said you were the first from the healthcare and delivery complex to serve on the board at Gilead. I would have thought that was a natural relationship as stakeholders and as, you know, users of the product. Why didn't that happen sooner, do you think?
I don't have an absolute answer because I wasn't there. What I would say is that the board, when I joined the board, it was a board of notables. So Gilead had not made a profit until the year before I joined the board, and I had nothing to do with making the profit.
Credit for it. Take credit for it.
That was strictly a timing thing. So I joined this board, and the board consists of George Shultz, Gordon Moore, co-founder of Intel, who created Moore's theory, Paul Berg, a Nobel laureate from Stanford. And I think back then, a big part of what the board did was influence. So it was influence, helping to get the company established, helping to get money that they could have to make the investments and things like that. As the company grew, Gilead was $4 billion in revenue, 4,000 employees when I joined. We're 18,000 employees now, and we were at 30 billion, at 25 billion now. You actually need a board to help to govern the organization. So that to me is why and how that transition took place. And so as you heard Dan and Tony say, our nominating process is very thorough. We first identify the gaps that we have in terms of competencies, and then we engage trying to find those people. And then, oh, by the way, if you can find additional minorities that fit those competencies, then that's a plus. And so, you know, as I retired from the board, Gilead was not afraid to say, okay, we had Kevin, we had a black lead independent director, we did that already. No, Tony was elected to be the new director, and okay, Kevin's retiring, we already had 2 blacks, we don't need to go back to 2, we were fine with Tony as 1. No, they elected Dr. Ted Love, another black individual, to come. So it's just not afraid to be able to be who we are and to know that having that diversity in the boardroom can make a big difference.
And Deb, I know there are a lot of people watching, a lot of people in the audience who are pursuing careers where perhaps it's starting to occur to them, hey, maybe we could talk about moving up to the board level. Talk a little bit about that, just as a career strategy. You obviously had a lot of other choices you could have made.
Yeah, no, thank you for that, because I happen to be also on a public board. And I will just say the work I do in terms of supporting the board, understanding the governance issues, understanding how the board operates was instrumental in me getting to the next level of my career. I also think not-for-profit boards, the big boards also, are a good stepping stone to understand governance and how decisions are made. And this generally understanding and have a specialty that you can add value to the board, whether as a former hospital executive or entrepreneur, former chief of staff to the CEO of United Health, like Tony. Everyone has something that they can bring to the board. So it's a matter of making sure that you're a deep expert in that, and then cast your net wide in terms of building relationships with headhunters, organizations like Global Black Economic Forum, because I understand they have a board accelerator program. I'm also a part of the Executive Leadership Council, which was really helpful to me as I started looking at boards, and just building relationships, because at the end of the day, that's what you need when you get on the board, to have those contacts that could be helpful to the company that you may be on the board with. That would be my advice.
And Dan, the supposition in a lot of cases, because you're a publicly traded company, is that you've got to answer to a lot of stakeholders, including some of the major shareholders. And I don't know if in your case it's pensions or other kind of large capital investors. But do they get it? Do they understand what it is you're trying to build here, and have they bought into that vision, or is this something that you have to kind of re-explain to them every quarter?
No, I think they get it. I think we often hear from our investors how important that is to their investment. I would have to say that Kevin has been extraordinarily centrist to being the lead independent director, and of course Tony now in that seat now. As it's important that investors obviously speak with management and the CEO, but it's also very important that they deliver those messages directly to the board and to lead independent directors. I may have Kevin comment just briefly on this, but what I would say is that the investors that are invested in Gilead, I think they acknowledge our strategy, number one. I think that's critically important. Part of what you've heard from Kevin and Tony and Deb here is that everything has to follow strategy at the end of the day. So if our strategy is around breakthrough science, curing diseases, and then equally our strategy is around breakthroughs in health equity and access for patients, then you need a board that kind of supports that and that represents the communities we serve. So it's extraordinarily important that we have scientists on the board, that we have entrepreneurs, that we have healthcare experts, that we have financial experts. And it's also important that they represent the communities we serve, right? So I think that's very important from both an ethnic diversity and also, but we've never compromised on the quality of the board member. And it's also possible to get ethnic and gender diversity while you're pursuing that for your strategy. And I think that's what investors appreciate. Kevin, you speak with investors all the time.
Yeah, and too many of our companies, kind of allow it not to happen, and find reasons not to happen. With Dan is comfortable with himself that he's willing to share with the board in terms of what happened. So Deb mentioned the meetings with the shareholders. I've been privileged for the last 4 years to be part of the team that would meet with the major shareholders, and Dan is not even in those meetings. And so we're talking BlackRock, Vanguard, State Street, Capital. I've been in all those meetings. And what it says to them, and every single time they say this to me, we greatly appreciate that you've been here, because they don't want to hear the CEO talk about compensation. I mean, let's face it. So they want to hear from an independent point of view from the board. So they'll ask me to talk about Gilead's strategy around compensation, around how the board is evolving. And they tell me, and Deb has heard this, that we don't see this from a lot of the other companies because they're not willing to be that open about it. So it does make a big difference. And then those are just those four that I mentioned comprise about 35% of all of Gilead shares. So if they're having that type of a positive view of the company because they see true shared governance, that's one of the reasons that they want to invest in Gilead.
Okay. If I can, the one thing before clock runs out, for those of you who are interested in boards, be a champion for yourself, okay? I am tired of people not prepared to accept the fact that people of color bring real value to enterprises. And I've been involved in some great enterprises. And I've met some great, talented people of color that I put my money behind every day of the week. Advocate for yourself, because you know what? They're not a bunch of rocket scientists running corporate America. And trust me, they're talented people, but they're no more talented than you are.
What he said.
That is a great note on which to end. Please join me in thanking this wonderful panel, Tony, Dan, Kevin, and Deb. Thank you very much.